ambos do such an amazing job, and they're there for us when we need them. And what the Mental Health Royal Commission tells us is we need to be there for our ambos when they need us. This work is not only high volume, 24/7, but it does take a toll. Over my 20 years in Parliament, I've had the great privilege of meeting many ambulance paramedics in many branches right across the state, and each of them can talk to you about cases that they've been called out to, jobs that they've done, as they call them, where what occurred never ever leaves them, So they carry that, and it's a fact of the work that they do. What we know is we can better support our ambos, our emergency services family in a broader sense, and that's one of the recommendations out of the Royal Commission in a broader sense. And today we announced that there will be a working group to do two things. One, to devise better plans, better policies, a better system to support the people who support us, to save lives every single day. We can do more and we can do better to deal with the toll that this job, this vocation takes on not just members, but also families. And the same goes for police and fireys and everybody across our emergency services family. Danny Hill is here today, and I want to thank him for his the way he advocates for his members, the way he makes sure that we as a government and the community more broadly know and understand what paramedics need. That's a great credit to him. The second of three things today, that working group will also begin the process of redesigning our mental health system. We need to be much less law and order focused. This is not a police issue, this is a health issue. And I think Wayne Gatt from the Police Association made the point very well, I think, at the exhibition buildings when he said the last thing we need is a community mental health system that doesn't work. People are then left to finish up in absolute crisis, and then all they can see coming at them are people in police uniforms. That is not a great model. That is not a safe model. We can rebuild this though. In speaking with so many ambos over such a long period of time, they're up to do this work. They want to do this work. Of course, there'll need to be additional training. There'll need to be all sorts of investments. But I think we can have a healthcare response to what is a healthcare issue, and that is much better, much safer, and much more effective than a law and order response to a health issue. The other point as well is a centre of excellence was also recommended to us, and today we take the first steps to create that. We need to bring together the best thinking, the best research. We need to bring together people who've got lots of ideas, lots of plans, and the lived experience, both professionally and as a mental health consumer or carer, to build this better system. I hope that as this week has unfolded, Victorians see really clearly that we're not wasting a moment. 30 years ago we deinstitutionalised mental health, and for 30 years we failed to build the replacement system, a system that keeps people well. If you're going to fix a problem, you have to acknowledge it. That's what we've done, but now it is time for us to invest. It is time for us to reform, to rebuild, and to better support people. It is all about much healthier, close to home, and early and at home, rather than late and in hospital. That's what this Mental Health Royal Commission calls us to do. That's what we will build. And again, I'll take this opportunity in advance and for all that they do now to thank our workforce. These people are the best of Victoria. We're very proud of them. We're very proud to have invested like no other government in terms of the way we support them, but also building a system, a much better system. To Tony, to Mick, to all the team, and of course those who work in this particular branch, we're very grateful to you, very grateful indeed.